Hey, what's up everyone? My name is Abhijit Minhas. I'm a physiotherapist with a keen interest in sports and orthopedic rehab. And in this video, we're going to take a deep dive into the right knee injury sustained by Ravindra Jadeja in the early part of September 2022, which has kept him out of a lot of important games for Team India. Jadeja is an all-rounder who's an integral part of the Indian national cricket team and has been injured in this particular incident that happened in the early part of September, which has been kind of controversial and has, because of that injury, missed a ton of games, including the World Cup, which was big and can be pretty gut-wrenching for a lot of cricketers. Here's the timeline. In the late part or the late August or early September of 2022, Team India went to Dubai, and while they were on a break and were not part of, like, the whole routine was not part of their official practice, the Indian team was involved in a team bonding activity which included some kind of water sports. So a bunch of the team was on the water. They were trying to do different exercises, again, to just build up the cohesiveness of the team, which is a pretty standard activity. But unfortunately for Ravindra Jadeja, during this incident, he was trying to balance on some kind of a surfboard. He lost his balance, and from the reports that we have seen, he had some kind of a twisting injury at his knee, and unfortunately had to be flown right back to India and was operated soon after. And we saw some of the pictures on Instagram. Now, the reason the whole injury has been controversial and has left a lot of fans and BCCI officials upset is because the team bonding exercise was not part of an official training schedule for the team, and basically the questions are being raised on whether a person who's had recurrent knee injuries and chronic knee injuries should have been doing a certain exercises which required balancing on an unstable surface on a surfboard. On his return to India, he was operated right away by the surgeon for BCCI, which is Dr. Dinshaw Pardiwala, who's an expert in arthroscopic surgeries for shoulders and knees. The surgery went off successfully. As you can see in the picture that he posted on his Instagram a couple of days later, you can see that he has a Zimmer splint on, which is basically something we use right after surgery to control swelling. And based on everything we have seen and the timelines of him returning, my educated guess on this would be that he most likely sustained a meniscal injury which required surgery. Now, what exactly and what are the kinds of surgeries, we'll try to dive into that a bit later. Now, could he have any potential involvement of his ACL ligament or his PCL? Possibly. Again, we don't know the details, but just looking at the timeline of him returning back and starting to practice and going to the grounds, I think this probably is a meniscus injury and not an ACL or a PCL injury. As we know, with ACL or other ligamentaneous injuries, the timeline for recovery to sports or return to sports is way longer, and the timeline to return to sports with a meniscus injury can be slightly shorter. So just the fact that he was injured in September, had a surgery in the first week or the second week of September, and he started to do some of these activities that I'll show you in a second, which he posted on his Instagram, tells us that most likely this could have been a meniscal injury, and potentially the ACL or the PCL and other important ligaments might have been saved. Alright, so let's now talk about meniscus. So meniscus are basically crescent shape wedges which are made up of fibrocartilage, which is a complicated way of saying that basically they are these cushiony material which tend to stay between, I have the model of the knee here, which tend to stay between the thigh bone, which is the femur right here, and the tibia, which is the leg bone. So basically, if you can see the structures here and here, those are the meniscus in the knee. From the back, if you take a look, there are a ton of structures running here, but as I open this area up, what you see here is the meniscus, which again is a bit of a fibrocartilage or a cushion, a wedge-shaped cushion, and then we have the meniscus on the outside, which is right here. So you'd often hear doctors and medical professionals, physiotherapists, etc. talk about medial and lateral meniscus. So let's break that down. So here's a model of the knee, and this would be a right knee. So that's the outside, that's the inside. So when somebody mentions a lateral meniscus, basically what that means is it's the wedge-shaped cushion on the outside. So again, lateral meniscus is the outside wedge, and the medial meniscus is the inside wedge. All right, so now let's talk about the role of the meniscus. So why do we have this in the knee anyway? So the meniscus is an integral part of the knee and it has some really important functions. One of the most primary role of the meniscus is basically shock absorption. So all the force of the body that kind of runs down the leg is often taken by these meniscus so that there is no bone-on-bone approximation. So it helps with shock absorption, it helps with load transmission. So think of activities where you're jumping, running, stuff like that, so that the joint doesn't go under a lot of stress. These wedge-shaped cushions are just basically providing a little more support for the joint so we don't have a ton of bone-on-bone rubbing into each other. They also play a pivotal role in joint lubrication and stabilization. And what I mean by that is, like, as we know, the knee has fluid in them, so they help with a little bit of lubrication. And the wedge-shaped meniscus actually increases the depth of the joint. So the end of the bone has more of a groove to kind of sit well within the joint itself. So all this to say that they have a really protective role for the knee, and they basically help prevent excessive wear and tear of your knee joint. Now, apart from the obvious traumatic injury that Ravindra Jadeja sustained during that unfortunate incident, who else do we tend to see these injuries in? So we tend to find that meniscal injuries have a higher prevalence in men more than women. We also tend to see people who have higher risk factors are generally older than 40 to 50 years of age. And a lot of times even professions dictate if you could have that. Personnel in the military seem to have higher incidence of meniscal tears. People who tend to do a lot of squatting for work, think of like laborers, think of any blue collar work like carpenters, plumbers, stuff like that, where there's a ton of squatting required, or even people who are participating in professional sports like Olympic weightlifting, powerlifting, which requires people to hold heavy weights and squat down or do Olympic weightlifts and stuff. Now, this is not always the case, but we often do tend to find that a lot of the medial meniscus, or again, the inside meniscus, tends to be injured with age-related changes, wear and tears, and the patients that we often see them with are older patients. So anywhere again, 40, 50, 60 plus, we tend to see a little more medial meniscus injuries here, which is wear and tear. And on the lateral or the outside meniscus, we tend to see more of those injuries in younger patients, especially athletes, especially involved in like lifting, cutting, jumping, landing, stuff like that. Now again, when somebody has a twisting injury, the chances are they can actually have injury to both the meniscus, but generally, as a rule, we tend to find outside meniscus more younger patients with like more sporting related activities. The inside is generally affected through wear and tear and age related changes. Now, I want to take a quick second to mention here that meniscus injuries generally don't happen in isolation. Oftentimes they can, but generally they do not. They are often associated with either ligament injuries along with them, which is basically what we call as the LCL ligament, which is again the lateral collateral ligament or the outside ligament, and we have the MCL ligament, which is the one that's kind of running right here, and that's again the inside ligament. Just again more support structure for the knee on either side. But we also have two other ligaments which often get injured, which are basically the ACL and the PCL. Now, to be able to see the ACL, I'm just going to try and pull the kneecap from here. And as we start to bend the knee, like if you can see that structure running at the back, from the front to the back, that is the ACL, which basically prevents excessive movement of the thigh bone on the leg bone. And at the back, we have the PCL, which is again the structure kind of running from here, and that would be again providing a little bit of support so that we don't have excessive movement of the thigh bone or the femur over the tibia. Now, oftentimes meniscus injuries can happen in combination, and a lot of players do injure these other structures as well. Once again, in case of Ravindra Jadeja, it's an educated guess just looking at the timeline of how he's returning back to sports that most likely he has not injured one of those other common ligaments, which is either the ACL or the PCL, because the timeline for those people with those kind of injuries is way longer than meniscus. So we are almost looking at a conservative of 8 to 9 months of physiotherapy with surgery or without surgery before they can start to come back. But meniscus injuries can actually return to sports a bit earlier. And just the fact that he's been injured in September and he's already back on the field a little bit is the reason why I think this is most likely a meniscus injury. Now, could there be potential injury to the inside ligament or the outside ligament? Again, the lateral or the medial collateral ligaments? Possibly, but again, we are not exactly sure about that yet. Now, classically in a physiotherapy or orthopedic office, when a patient comes in and they've not had a traumatic injury, or even if they have had a traumatic injury, sometimes the test that we try to use to understand whether there's a potential meniscal problem is basically a physical examination where your doctor or your physio is going to take a look at the knee, notice if there's any swelling around the knee, do some physical examination and test, see if there's excessive popping, clicking, see if you can completely bend and straighten the knee. So oftentimes with meniscus pain, you would have discomfort either at the end or the beginning, which by the way doesn't mean you won't have it while your knee is bending, but generally we tend to find like a blocking sensation, or maybe a buckling sensation in the knee when you're trying to bend and extend the knee. These tests give us a bit of an idea. However, in case of Ravindra Jadeja or any other pro athlete, once they're injured, most of the doctors know that these tests only give us a bit of an indication whether it could be a potential meniscus injury, but it's not a 100% accurate way to find out. The one test that can really accurately tell us the severity, the type of injury is actually an MRI. MRI should be the gold standard, and when athletes, professional athletes like those from the Indian cricket team or any other professional athletes, when they get injured, I think the gold standard to see whether there's any injury to the meniscus is just through an MRI. But we also use these other tests along with it to try and establish what potentially could be injured, along with the history of asking questions of that popping, clicking, and other sensations. Now, within the meniscal tear, there are various types. So in the image that you see right here, you'll find that we have vertical tears, we have transverse tears, we have bucket handle tears, we have degenerative tears. So we have a ton of different tears, and depending on what tear we find in an MRI, that would often dictate if a certain kind of approach or surgery or rehab has to be taken. Now, whether a patient would be treated conservatively just by physiotherapy, pain medication, stuff like that, or whether a person would have to undergo a surgery is really dictated by a bunch of reasons. Number one, the age of the person, the profession. So obviously professional athletes would most likely lean towards a surgery to fix the problem, as opposed to somebody who's in like their late 80s and doesn't want to get a surgery and is not that active. The type of tears that we just discussed, area that could be affected. So we have these tears, but it also depends on where these tears are present within the meniscus. So if this is the crescent shaped meniscus and this is the outside portion and this is the inside portion, we can roughly divide the meniscus into 3 zones. As you'll see in the pictures here, we have the outside and the most outer layer, which is called as the red zone. We have the middle layer, which is the red-white zone, and then we have the inner layer, which is the white zone. And simply putting it, the outside layer, which is the red zone, is basically called the red zone because it has a lot of blood supply. And as a general rule of thumb, if you have more blood circulation and supply to an area, the chances of that tear healing is way better than, say, a tear in the middle zone, which is a red-white zone, where the middle part of the meniscus has slightly compromised blood supply. So the red zone would heal much faster than the red-white zone, and the slowest healing injuries, and probably not even heal as well, are injuries in the white zone. So when on an MRI we see some kind of injury in the white zone, those would also dictate whether a person may be going in for surgery or going through a conservative management. Now, in case of Ravindra Jadeja, again, we don't have the details, but the fact that he had to go through an immediate surgery tells us that most likely he injured one of the meniscus. My potential guess could be lateral, but at the same time, this was an awkward movement, so he could definitely have had a medial meniscal tear as well. but I think you most likely had a complex bucket handle or a more severe tear, which did not just stay in the red zone, but would have probably been in either the red white or the white zone, and that's why the surgeons decided to operate on that knee. Now, let's talk about the surgeries. Again, we don't know what exactly the surgery was, but if we do decide to go down the surgical route, what are the options do we have? So, the two most common surgeries that are often performed for meniscus injuries, the first one is a partial meniscectomy, which basically means that the surgeons would go in arthroscopically, which basically means they use these endoscopes or wires which have a camera. They make small incisions in the knee and they put these probes in, and they can actually watch a video on the camera, and while they kind of put the probe in, they can see where the injury is. And in a partial meniscectomy, basically there's no repair happening. So what they'll do is they'll go in and cut out the piece of meniscus that might be floating around within the joint cavity or within the joint, or anything like in the white region that could be potentially causing some of the blocking in the knee. So that would be a partial arthroscopic partial meniscectomy. Once again, there's no repair, there's only removal here. Now, the second option would be arthroscopic meniscal repair. Now, a meniscal repair is considered to be slightly more favorable than the meniscectomy, because in this surgery, surgeons actually go inside and repair the meniscus. Now, while the healing time or the recovery time might be a slight bit longer with partial meniscal repair or arthroscopic meniscal repair, we do find that overall, if we can have our patients go through an arthroscopic meniscal repair, is way more favorable than a meniscectomy, because as we know, we still preserve, we heal the meniscus, but we still preserve the meniscus. And if you remember from what we discussed about the role of the meniscus has this shock absorption property and helps prevent wear and tear. So imagine what happens to a patient when you actually go in and decide to take the part of the meniscus out. Now, the repair or the recovery from that surgery is slightly faster than a meniscal repair, but in a partial meniscectomy, we are opening the floodgates for future osteoarthritis and degeneration in patients. So we really have to weigh the pros and cons, and surgeons have a bit of a, decision making to do here. But we often, as a medical community, do agree that if we can save the meniscus and do a meniscal repair, even though the healing process would be a little longer, it is better for overall longevity of the knee as compared to a partial arthroscopic meniscectomy, where you may start to feel better much quicker with the surgery, but the long-term outcomes of developing wear and tear within the knee are slightly higher. Now, the reasons surgeons prefer to do a meniscectomy and remove a part of the meniscus and not heal it is most likely dependent on the type of tear. So if it's a complex bucket handle tear, and if the tear is present in either the red-white or really the white zone, we know that it can't really be repaired because of poor blood circulation. So most likely in those cases, we tend to choose a meniscectomy just because we know that the outcomes for the repair are not great. Now, we all hope that Ravindra Jadeja returns to the national team again and starts playing, but for his overall health, let's keep our fingers crossed and hope that he did receive a meniscal repair and not a meniscectomy. Given his age and just because he's younger, most likely chances are that he would probably have higher chances of having a meniscal repair, but again, it could go either way. Let's start talking about something which I deal with a lot. So I didn't want to dive a lot into the surgical part just because that's not what really I do. But what I do is the next part. So I tend to spend way more time with my patients who have these injuries because the rehab process is much longer. So oftentimes you would hear patients say that the physiotherapist tends to spend a lot more time with them than a surgeon. Now, what does physiotherapy with the meniscus repair or meniscus injury look like? If a patient has had a surgery and we are seeing him post-op, which is post-surgery, the first couple of weeks is basically, number one, trying to follow any surgical guidelines. If the surgeon has given us any restrictions on how much of weight bearing should be put on the leg and how much of bending and extending and how much can we move the leg. So we always want to respect any surgical guidelines or restrictions that may have been put on the patient. Now, if you don't have a lot of restrictions, and if the surgeon has given the green light to really start training the knee, then generally speaking, the process kind of looks like this. So we have the initial phase in which we are basically trying to control the swelling, the pain. So you'd use things like ice, some electrical stimulation. We can basically just start with some simple ankle range of motion exercises, sliding your legs, stuff like that. Again, just to control pain, swelling, get the leg moving. And as those things start to get better, we start to go further and further into progressive strengthening and mobility exercises. So just increasing the ability of the knee to regain its full range of motion, and to start to work on strength on some of the primary muscles around the knee, which generally are always the quadriceps, which are the muscles in the front of the leg, the thigh muscles here, the hamstrings, which sit at the back, which are over here, a little bit of the adductors or the inside muscles around here, and calf muscles. So along with that, we also tend to work on general fitness, because as we know, Ravindra Jadeja would be returning back to his performance, but initially we are only kind of concerned about taking care of the initial symptoms. So we work on the knee, the hip, the ankle, and as he starts to get better and better and starts to lift more weight, we start to slowly introduce the sport specific kind of exercises, and you'll see a whole list of these exercises right here. So this is a general idea of what physiotherapy rehab exercises would look like. So the initial part of the rehab exercises involves some easy exercises like you saw in the previous videos, where I'm pushing my heel down, my knee down, raising my leg up, turning to my side and raising my leg up, just trying to work on all the muscles around the glutes, the hips, the quadriceps, the hip flexors. Now, this next exercise may not be performed as early since it requires kneeling, and that may be a bit hard, but still, as our patients start to tolerate that pressure, we start to do this exercise, which is relatively easy. It's a body weight exercise. And then from there, certain more easier exercises to perform initially would be like a glute bridge, again, trying to work on the core, the hip musculature, and then progressively making it a bit more challenging by putting pressure just on that one leg. And finally doing a full legs single leg bridge workout. And from here, I really like the bridge workout or the hamstring workout. It's a great exercise to get the hamstrings burning. Give this a shot. It looks easy, but it's quite challenging. And then doing some cycling in the initial part. Now this is an Airdyne bike, you don't have to use that, just a recumbent bike would do. And starting after that, to load the leg up with some body weight squats. And here you can see me perform some forward lunges. We don't have to start with forward lunges if it's not well tolerated initially. We could do some stationary lunges or some backward lunges. And then moving on to some lateral lunges, since we know sports involves a lot of lateral movement. So we definitely want to start to train that, get the adductor muscles involved, get some stretch going, workout going. Now, one of the things that is paramount with these kind of injuries is to build up your quad strength. In the past, we had started to move towards more sports specific workouts, but we have in the last couple of years again started to push towards like general quad strength, because a lot of research does tend to suggest that quad strength does positively affect outcomes after a surgery. And here you can see me working on just one single leg. Now from here we start to work on some compound movements like some step ups. You can play around with the height of the step up to make it more challenging or slow the pace down, or you can load the exercise up with some kettlebells and just progressively keep loading it up with more and more weight as the patient starts to tolerate it a bit better. Some lateral step ups, again, just to get some groin muscles involved as well. And then a split squat. We can start with body weight and then slowly start to add some kettlebells or other weights. And then moving on to some other strengthening exercises like the barbell back squat, which is an excellent exercise to work on your quadriceps, your hamstrings, your core, glutes, all of that good stuff. And from there, we start to work a little bit on deadlifts, great exercise to work on the posterior chain. So you may find Ravindra Jadeja would be doing all of these exercises with their trainer as he starts to get better. And finally, we start to add some plyometric exercises. So soft landing, jumping. These are more advanced exercises when our athletes start to return to sports. So again, practicing landing off a box. You saw the skater squats between, skater hops, sorry, and again, some more jumping. So these are some ideas of some of the exercises that we use in the office.